Please be aware that this video is intended as an educational resource only and should not be used as personal medical advice. All decisions about the management of your health or condition should be made in conjunction with your specialist or medical professional. So, what is an ACL repair? An ACL repair is surgery that rebuilds the ligaments in the center of your knee. This ligament is called the Anterior Cruciate Ligament, or ACL, and it keeps your shin and thigh bones properly connected together at the knee. A tear in this ligament can cause your knee to give way during physical activity. ACL reconstruction surgery uses a graft to replace the ligament. The most common type of graft is done using a small part of your own body, such as the tendon of the kneecap, the patella, or one of the hamstring tendons. To better understand your procedure, we should take a few minutes to learn a little bit about your anatomy, the procedure, the risks and issues involved. Your knee joint is the largest joint in your body and contains 4 bones and a large collection of ligaments and muscles. The bones are the femur or thigh bone, the tibia or shin bone, and the smaller fibula and the patella or kneecap, with only the femur and the tibia forming the knee joint itself. Where the femur and tibia meet is covered with articular cartilage, an extremely hard, smooth, slippery surface that allows smooth, pain-free movement in your joints. On both sides of the knee, there are 2 strips of long, flexible cartilage called the menisci that act as shock absorbers and help minimize friction. The stability of your knee joint is governed by 4 ligaments, which secure the knee together. These are the medial collateral ligament, or MCL, the lateral collateral ligament, or LCL, providing side-to-side support. Then, the anterior cruciate ligament, or ACL, and the posterior cruciate ligament, PCL, providing front-to-rear support. There are also bursas between the skin and the kneecap, the prepatellar bursa, and another above the kneecap, the suprapatellar bursa. These are small sacs of synovial fluid, like tiny water balloons, with only a few drops of fluid in them that cushion the knee while it's in motion. Each part of your knee needs to function properly for the knee to work as a whole. So, why might you need an ACL repair? An ACL injury is typically a sports-related injury, and you most likely felt your knee give way under you the instant your ACL was torn. The most common reason for an ACL tear to occur is when pivoting or landing from a jump, with about 80% of these sports-related injuries being non-contact injuries. A non-contact injury means that the injury occurred without the involvement of another player, such as in a scrum or a tackle. Also, female athletes are much more likely to suffer an ACL tear while participating in competitive sports due to skeleton design, knee strength, and hormonal issues. We begin with your diagnosis. Firstly, an orthopedic surgeon will examine and evaluate your symptoms to ensure a proper diagnosis in order to provide the best treatment outcome. Your orthopedic surgeon will discuss and record your medical history, perform a physical examination, request diagnostic studies such as X-rays or MRI. An MRI is magnetic resonance imaging, where magnetic and radio waves are used to create a more detailed computer image of soft tissue, nerves and ligaments. During your procedure. During your surgery, an arthroscope will be inserted into your knee to assess and repair ACL damage. Even though the arthroscope and other surgical instruments used are very small, typically only 3 to 4 millimeters in diameter, the high-definition camera attached to the arthroscopes displays the image on a large screen, allowing the surgeon to see every part of your knee joint and to assess the type and amount of injury and repair or correct the problem as needed. The major benefits of arthroscopic surgery compared to traditional open surgery include less pain, much smaller incisions, faster healing time, less scarring, lower infection rate, minimal soft tissue trauma, faster return to full mobility, and is typically performed as outpatient or day surgery. Your surgery will be performed in a hospital operating room under general, spinal, epidural or local anaesthetic, depending on you and your surgeon's wishes. Currently, almost all ACL reconstructions are done using an arthroscope. An arthroscope is a small tube that contains optical fibres and lenses with a digital camera that can be inserted into the body, giving doctors a view of inside of your knee. To begin your surgery, your surgeon will make 2 or 3 small incisions around the knee. Each of these incisions is called a port and result in very small scars that are normally not very noticeable. Then a blunt hollow tube called a trocar is inserted into each incision or port. The trocar holds the incision open and allows access without the potential additional trauma caused by the insertion and removal of the arthroscope and any other surgical instruments. Then a sterile saline solution is pumped into the knee through one incision to inflate it and wash the blood from the area and allow your surgeon to see more clearly. Surgical drills are inserted through the other small incision. The surgeon then drills small holes into the upper and lower leg bones, where these bones come together at the knee joint. These holes form small tunnels through which the graft will be anchored. Then, the surgeon will make another small incision in the knee and take the graft to be used in your repair. The graft is typically taken from a tendon at the front of the knee and just below the kneecap, called the patellar tendon, and will include 2 small pieces of bone called bone blocks on the end of the tissue. One piece of bone is taken from the kneecap and the other is taken from the lower leg bone near the near joint. A larger graft allows better healing because the tendon is still attached to the original bone and the bone heals into its new location much faster. The graft is pulled through the 2 tunnels that were drilled in the upper and lower leg bones. The surgeon then secures the graft with hardware such as screws or staples and will close the incision with stitches or tape. The knee is then bandaged and then you are taken to the recovery room for 2 to 3 hours. Often during ACL surgery, your surgeon may be required to repair other injured parts of your knee as well. After surgery, your surgeon will provide you with a post-operative course of action to aid your recovery. This will depend upon the type of surgery performed. Your post-operative plan may include specific instructions regarding your lifestyle, activity or rehabilitation, prescription medications to keep you comfortable at home, instructions about wound care and bathing. Typically, you may shower once the dressings are removed unless otherwise directed by your surgeon, and physiotherapy if required to restore normal function and strength. Benefits and risks. As with any surgery, there are always potential risks. Your decision to proceed with the surgery is made because the advantages of the surgery outweigh the potential disadvantages. It's important that you are informed of these risks before surgery takes place. Complications can be medical, general, or specific to the surgery. Medical complications include those of the anaesthetic and your general well-being. It should be noted that the vast majority of patients suffer no complications following surgery. However, complications can occur with any surgery and may include allergic reactions to medications, blood loss requiring transfusion with a low risk of disease transmission, heart attack, strokes, kidney failure, pneumonia, and bladder infections. Complications from the use of nerve blockers, such as infection or nerve damage, serious ongoing medical problems or concerns, leading to prolonged hospitalization or very rarely death. Specific complications. Infections. Infections at the incision or portal insertion site, or a more serious infection at the location of the surgery. Nerve damage, tingling, pain and weakness from nerve damage or nerve trauma. This may be temporary or permanent and can cause numbness. Hemarthrosis, excess bleeding into the joint or surgery site. This may require additional arthroscopic surgery to irrigate the joint and evacuate or drain the blood. Blood clots or deep vein thrombosis. These typically form in the calf muscles and can travel to the lung, causing a pulmonary embolism. These can occasionally be serious or even life-threatening. If at any stage you get calf pain or shortness of breath, you should notify your surgeon immediately. The failure to relieve pain. This is rare but may occur, especially if pain is coming from other areas, such as the spine. There are risk factors that can negatively affect your healing after surgery, including general ill health, poor nutrition, smoking, obesity, diabetes, age, over 60, alcoholism, chronic illness, and steroid use. Weighing this all up and having a good understanding of the procedure is important. If you have any doubts, questions or queries, please consult your specialist or medical professional.